The great state of Hawaii is also starting to see a pickup in cases, but since the start of the crisis, the Aloha state had mostly made it through the pandemic safely. Dr. Josh Green, an ER doctor, also happens to be the lieutenant governor, joins us tonight from Honolulu. Dr. Green, it's good to see you.
You too. Thanks for having me.
No new deaths since May 3rd, the lowest mortality rate in the United States. You're being called a rare success story. How have you done it?
Well, we did a couple things. We isolated cruise ships as a risk very early, so that was stopped. Then we tested everybody that we could. That gave us a picture of where we were as a disease state. Then we did a 14-day quarantine as of 3 months ago today, in fact. So 3 months of a 14-day quarantine for any travelers coming in or any return visitors, our own people. And that knocked the virus out pretty well. We trace everybody, and we're now getting ready for the newest innovation, which is starting August 1st. We will reopen the state, but people will have to have a test within 72 hours of travel to Hawaii. And by doing all that, we keep the rate very low, we restore confidence in our economy, and we get through this alive.
So to make sure I understand what you're saying, I arrive at the airport and I need to show paperwork or some sort of proof that I've had a test in the last 72 hours and I'm negative, and then I can come in.
That's exactly right. So we're working on national partnerships with CVS. We've reached out to Walgreens, Kaiser, so you can easily get a test. You won't have to have a doctor's order. You get that test, you pay for it, then you come to paradise with everybody else. But the good news is we will continue to have the lowest rate of COVID in the country. And for people who do vacation here and work here and live here, we can all be assured that we're in this together, that the case rates are very low so people can actually have this best experience of their lifetime in Hawaii.
Will you have real-time testing available at the airport for arrivals?
That's a brilliant question. The inclination for us right now, and we just announced this yesterday, is to insist that everybody out there get a test before coming. So I'm saying this to America right now. Family back in Pennsylvania, New York, California, please get your test within 72 hours of travel, and then you will not have to have quarantine. And that's the way we really keep the cases at a minimum.
Yeah, I mentioned, of course, you're a doctor. You're also the lieutenant governor, so you can speak on a number of different issues. From the state standpoint, do you have any idea how much revenue you lost from tourism as a result of the pandemic?
I do. Well, I can give you a lot of indicators. One of the challenges of having such success keeping the virus down by locking it down was, of course, unemployment soared because tourism went down to nothing. We decreased our travelers down 99.6% over the course of this 3 months, which is a shocking number, and our unemployment's at 22.3%. We've passed out $1.7 billion in benefits to keep people going, and we've lost hundreds of millions of dollars. So all of these things are just very real for our people on the one hand, but then, of course, we've only had 17 fatalities so that people can celebrate that victory. By opening on August 1st with the test, we expect tourism actually to pick up quite quickly because there's this pent-up desire, of course, to be safe, to escape from the harsh reality of COVID, but do it safely.
Yeah, how do we judge this uptick in cases, and how concerned are you about that and how it may impact the psyche of people who want to travel there?
Well, my fellow lieutenant governors and governors kind of scoff at me when I talk about going up in cases, because when we say going up, we went from like 6 to 17 cases. They're used to having 17 cases a minute in some cases. So we've had a very mild rise, and it's attributable to, of course, we had Memorial Day. We opened up some of our businesses. We did have peaceful protests here in the state of Hawaii, and all these things contributed. But we are really kind of just simmering at a very low level right now. And I can tell you this, our ventilator use has actually been very flat at 13% statewide, utterly low. And our intensive care unit beds have also been stable. We've only been using about 44 to 45% of them. So I'm monitoring multiple different variables as we look at it, so it will be safe for people to come, but now safer than ever with the test. So I think it's been very good. We're proud of what our people did to sacrifice, but we want to reward that sacrifice with safety.